Hello, flight instructors and NAFI members. John Niehaus, Director of Program Development for the National Association of Flight Instructors, welcoming you back to another episode of the NAFI More Right Rudder Podcast, the podcast for flight instructors on the go. And today, this episode is sponsored by our friends at Sporty's Pilot Shop. Now, May is Learn to Fly Month at Sporty's. It's a 4-week celebration of learning to fly designed to inspire and help new pilots achieve their aviation goals. In addition to savings on popular pilot gear, Sporty's Media Network will celebrate Learn to Fly Month with articles, videos, webinars, and more. Visit sportys.com/Learn to Fly Month for more information. Now, I'd also be remiss to not thank Sporty's for their longtime sponsorship of NAFI. They've been friends of ours for a really long time. And please remember that Sporty's also provides 20% of most training products for NAFI members. So check out your membership account and go to the discounts page and you'll see some really good discounts from them in addition to the cool discounts you can get for Learn to Fly Month. Anyhow, this month's presentation is a rerun of a Mentor Live. Now, forgive us if you've seen this one before, but it ran in April, so it's a recent one, but it's such an important topic that I wanted to run it on this platform as well. So for those of you that maybe aren't familiar with Mentor Live, have an opportunity to listen to it. Now, this was, the topic is pilot mental health. And it was presented by one of our very own board members, Dr. Victor Vogel. And you'll get to know a little bit about him in the presentation. But, pilot mental health has really sort of come up to the forefront, and I think it's really important that it does. We've ignored it for a really long time, and we've seen sort of the aftermath of what happens when you ignore something so important. I think sometimes people forget that pilots are human too, and as much as we try to ignore that fact, it's important to come to grips with it. Things happen to pilots just like anybody else, whether it's death in the family or any other tragedy. Sometimes we're just kind of sad. So, how do you handle that? How do you deal with that? And how do you know when you cross the line from just normal feelings into something you might need a little bit of help with? So Dr. Victor Vogel is here to help explain some of this stuff to us, and it's the first of many. You can't really cover everything in just 1 hour of Mentor Live, but I think you'll find it very valuable. Hopefully it helps, and again, it's sort of that first brick in the wall. So once again, Dr. Victor Vogel, Pilot Mental Health.
So once again, Dr. Victor Vogel is a longtime pilot, CFI, CFII, get to serve with him on our board of directors. And he's had a short career, or not. Dr. Vogel is a board certified medical oncologist, and he's a breast cancer doctor. He earned his MD from Temple University, did his residency and fellowship at Johns Hopkins. He is the former VP of research for the American Cancer Society. And that wasn't enough, so he earned his CFI, CFII, AGI, and IGI, and serves as a FAST team representative, and is actually the founder of a STEM program in Central Pennsylvania. And again, as I mentioned, he's a member of the NAFI board of directors. He's owned several airplanes. And how many states are you up to now, Victor, that you've flown in?
40 and counting.
40 states. I've got some catching up to do. So welcome back, and thank you for doing this again, Dr. Vogel. I'm going to go ahead and hand the flight controls over to you, and off we go.
Well, thank you, Aaron. It is a pleasure to be here once again. And let me just start by saying we must stop the death of pilots on purpose in our general aviation airplanes. And all of us pilots and flight instructors and people in the general aviation community can help to do that by raising our awareness and our understanding of pilots' mental health and the signs and symptoms and what we can do to prevent tragedies in our airplanes. So let's start by reminding us of one of those tragedies that was actually not in a general aviation airplane, but occurred in Europe about 9 years ago. And this was on a German airline called German Wings. And they were flying from Barcelona, and they were on their way to Dusseldorf. And they had 144 passengers and 6 crew members on this Airbus. And the captain left the flight deck and went to use the restroom or get a cup of coffee or something, and left the aircraft in control of the first officer, a young man named Andreas Lubitz, who was 27 years old. And he had been treated for suicidal tendencies and had seen his primary care physician, who declared that Mr. Lubitz was really, from a mental health standpoint, was unfit to fly. But the pilot, Mr. Lubitz, and his doctor both failed to report this to the German Wings airline. And they reached cruise altitude, and with the captain, as we said, out of the cockpit, Mr. Lubitz flew the Airbus into the side of one of the French Alps and killed all 144 passengers and 6 crew members. There was also a well-known incident with a flight instructor and a student in Kentucky, and this was written up in our January-February issue of Mentor magazine. This was very unfortunate because the flight instructor was the affected person here, and he exhibited a number of hazardous behaviors and berated the student pilot. They were on a night flight, and the CFI recorded this on his cell phone and was making disparaging comments about the pilot. And then, unfortunately, this not well flight instructor and this student, under the direction of the flight instructor, flew into a supercell at night, and they both perished in that accident that, in my opinion, did not have to happen. And then very recently, in January of this year, in Texas at one of the flight schools, one of the students in the flight school named Logan Timothy James, who was 23 years old and from North Carolina, he got in the airplane at Addison Airport at about 7 o'clock in the evening, took off and headed east, and then talked to air traffic control. And you can see the context and the words from the ATC recording. And pretty much this young man announced over the radio that his intention was to climb up through the clouds and then turn off the radios and kill the circuit breakers so nobody could speak with him. And he put the aircraft into a steep dive, as you can see on the left there. The ADSB recording showed a descent of over 4,700 feet a minute, and he crashed into the ground about an hour after takeoff, killing himself. And we have every reason to believe, based on what he said, that this was intentional. And these accidents need to stop, and we need to do everything we can to make sure they stop. Now, all of us have this sort of happy picture of aviation, be it commercial or general aviation. We like to see happy, smiling faces and people enjoying their jobs and being well, both physically well and psychologically and emotionally well. But unfortunately, that's not always the case. And so what we want to do is review I'm going to put on my epidemiologist hat, look at some statistics about the prevalence of mental illness and mental health symptoms, signs and symptoms in the population. And we'll look at some data regarding the pilot population, although there's not much data about the general pilot population, but we can rightly assume that the prevalence of mental illness among general aviation pilots reflects the prevalence of mental illness in the population in general. So we will talk a couple of times in the next few minutes about the Aviation Rulemaking Committee report, and the FAA commissioned in May of 2015, after that German wings crash and another crash of the Malaysia 370 flight. They established this committee to look at pilot fitness from a mental health perspective, and I'll have more to say about their final report, which was just published and made public about 2 days ago. And the FAA has acted on the recommendations in that report, and essentially FAA has agreed to increase awareness and understanding about pilot mental health issues. They're ramping up their training of aviation medical examiners. I am not an aviation medical examiner, but try to stay close to the recommendations that AMEs receive from FAA. And they also encouraged that peer support among all us pilots to encourage pilots with these difficulties to seek help. And we'll say specifically how we can encourage pilots to do that. Now, the preliminary report came out from the Aviation Rulemaking Committee last November, and they said that the best strategy for minimizing these risks that were related to mental illness was to create this environment that's supportive and encourages pilot self-disclosure. One of the things that is preventing us from doing better in helping pilots with these issues is that there is a stigma and a negative culture about admitting mental health concerns and issues. And we're going to talk a little bit more about that. And we have to look at mental health issues as being no different than if somebody had heart disease or diabetes or arthritis or any medical condition where they could still be medically certified to fly, but we don't attach a stigma to those things like high blood pressure or arthritis or whatever we may fly with. And we have to get to a point where we remove the stigma from mental health issues. And many pilots, particularly professional pilots, but even general aviation pilots, perceive the self-reporting of mental health signs and symptoms as being high risk, and it may put them at jeopardy to lose occupation, to lose the opportunity to fly, to lose their medical certificate, a number of losses that can occur. So it's very critical that we as a community support pilots with these diagnoses and make the access to information timely, accessible, and accurate. And that is one of the recommendations from the final report of the Aviation Rulemaking Committee. And so we're going to talk about try to increase our awareness of the signs and symptoms that all of us pilots need to be aware of, so that we can get these affected individuals to where they can find help. And this isn't just about pilots. It could also be true of air traffic controllers or mechanics or airport managers. Anyone we encounter in the broad field of general aviation could be affected with these signs and symptoms. And we want to make sure that the information remains confidential, but we want to remove the stigma and the name calling, and we want to create an environment that's safe for pilots to report these symptoms and get help. So let's talk about the prevalence of mental health issues in the population in general. This is a prevalent problem. It affects a large proportion of the population. So our tax dollars fund a number of institutes in the National Institutes of Health, and the National Institute of Mental Health did a survey a few years ago, and they surveyed a representative sampling of the entire U.S. population that's representative of both gender and age and race and ethnicity. And they estimated, this is a staggering number when you first encounter it, that nearly 58 million adults in the United States who are 18 and older had any mental illness in a single year. 58 million people in the United States in 2021 had some sort of mental illness. And that's about almost 23% of all U.S. adults. And it's higher among females than males, but as I like to say, there may be underreporting in males. Why do I say that? Because women, because of childbearing and health issues that many women deal with, they have more contact with the healthcare system and may be more likely to divulge signs and symptoms of mental illness, whereas males have less exposure to the system and maybe don't have the opportunity. So it is likely that the difference between men and women in terms of the prevalence of mental illness may not be as large as this 9% difference shown on this slide. Among younger individuals who, for us flight instructors, this is often the majority of our learners, younger individuals 18 to 25 have the highest prevalence of mental illness, and it's more than a third. So that's a big number, and that's in 1 year. And adults, middle-aged adults, younger middle-aged adults, 26 to 49, little higher than the overall average at 28%. But we mature folks, by the time we get 50 and older, have lower rates at about 15%, likely because we've either learned to deal with life stresses or we are better at utilizing the resources that can diagnose and treat mental illness. So those are the numbers to keep in mind. Now, they also, in a survey in 2021, looked at drug use. And when I say drug, I should say medications. This is not illicit drug use. This is prescription drug use. But among those 58 million adults with mental illness, 26 million, 47%, received mental health services in the past year. Now, you may say, well, that's good. Almost half of them did. But that also says that 53% of that 58 million people did not receive mental health services, and that's a concern. Once again, more females than males, but remember, there may be underreporting in males. And the young adults received mental health services, about 45% of those with mental illness, and about half of both the younger middle-aged folks and the older folks received drugs to treat mental illness. But notice this bottom point here in the red box. That's serious mental illness. This is mental illness that would impair your ability to make rational decisions and have behavior that was not affected by your mental illness. That's 5.5% of adults every year. So that's more than 1 in 20 adults every year have signs and symptoms of serious mental illness. Why do I tell you all these numbers? The point is, this is not rare. This is not something you're going to see once in a lifetime. If you look, and you look carefully and you look at enough individuals, you'll find it every time you look. So among these 14 million adults with serious mental illness, 9 million, 65%, received mental health treatment. And we will define what serious mental illness is here in just a moment. And treatment was defined as having inpatient treatment or counseling, or outpatient treatment or counseling, or using a prescription medication for problems of emotions, nerves, or mental health in the past year. So this is a lot of people. This is millions of people. It's not hundreds, it's not thousands, it's millions of people. So we need to recognize that these illnesses, some of them a little mild, some of them can be very severe. These are not rare, and we will see them in the population and in the people that we train and know as pilots. So where does this come from? Well, part of it is caused by genetic and environmental factors. And there are a number of inherited traits, environmental exposures in utero, before birth, changes in brain chemistry that affect these chemicals we call neurotransmitters. The nerves in our brains and our peripheral nervous system send out chemicals. Think of those chemicals as baseballs. Those are the neurotransmitters. And they go to receptors. Think of those as the catcher's mitts. And there can be disruptions because of genetic abnormalities in either the transmitters or in the receptors, and that can lead to mental health disturbances. And when these networks are impaired, the receptors change, and that can cause depression and other emotional disorders that we'll talk about. And it is a true fact that mental illness is more common in people whose blood relatives, their biological relatives, have also had a history of mental illness, something to keep in mind. Now, this is data from the Mayo Clinic, and they echo the fact that a history of mental illness in a blood relative, just like we've seen, is a contributing factor. But stressful life situations, things that we're all exposed to, financial problems, loss of a job, the death of a loved one, a parent, a child, a spouse, a divorce, or other marital difficulties, all of these things can lead to signs and symptoms of mental illness. A chronic medical condition that causes significant symptoms, be it diabetes or heart disease or arthritis or whatever it might be, those conditions can also lead to mental health signs and symptoms. Brain damage, people who've had head trauma, athletes with concussive syndromes after playing contact sports like football, and especially people who've been in combat situations. Our military veterans can suffer from post-traumatic stress disorder, which has a spectrum of symptoms that we need to be aware of and that can appear. Overuse of alcohol or recreational drugs can lead to mental illness. A childhood history of abuse or neglect. Children that are sexually abused or physically abused or neglected, they can grow up to have significant mental health issues as adults. People who are loners and have few friends or healthy relationships is also a cause of mental illness, as is a previous history. So if someone in the past has had episodes of depression or a failed suicide attempt, they are at risk for future events and symptoms. Now, as I said, there's not a lot of data in general aviation pilots, but there are a couple of published studies in airline pilots, which is kind of sobering when you look at these data. There was a study done about 8 years ago where they asked airline pilots to take an anonymous survey that included a questionnaire just to assess one mental illness, and that is depression. And in that survey, they found that more than 12%, 1 in 8 pilots, airline pilots, were managing depression, and 4%, 1 in 25, had reported having suicidal thoughts without treatment. Why? Because of this stigma and this fear of loss, of having negative impacts on their career. You can imagine as a professional pilot what impact it might have to report suicidal thoughts. And then there was a second study in 2019 that showed that pilots avoid seeking health care, and more than 38% of pilots feared losing their medical certificates and reported that they were withholding information from their primary care physicians. So not just from their aviation medical examiners, but even their PCPs, they were not fully divulging the signs and symptoms that they were aware of. Now, all of this led to a request from Senator Dianne Feinstein, who's now, I believe, retired, was from the state of California, but she requested that the Office of the Inspector General in the Department of Transportation do an evaluation of the situation regarding pilots' mental health. And that report that came out just a short time ago said that it showed that the FAA has procedures in place to evaluate pilots' psychological health. And the report found, the Inspector General found, that there were extensive instructional processes to evaluate pilots' psychological health, but that the FAA's ability to mitigate the safety risk was limited by, once again, the pilots' reluctance to disclose their mental health conditions. And 3 primary factors were identified by the surgeon, by the inspector general, that the stigma associated with mental health, that somehow if you had mental health issues, that there was something wrong with you, you weren't normal. So there was that stigma and judgment from peers and the population in general. And this fear of potential impact on careers, that pilots might lose their jobs or ability to fly, and financial hardship largely caused by loss of income if they weren't permitted to pursue their livelihood. And this report said that these barriers need to be addressed by the FAA. Well, that is what the Aviation Rulemaking Committee has just completed, a months-long survey of the situation, and they made some reports. Now, this report last July from the Office of the Inspector General said just what we've said, that there's this stigma and there's this problem with reporting, this fear of financial hardship and impacting pilots' career. And also there was a concern about the amount of time that it takes once a mental health problem was identified to get through the process of medical certification in the FAA. Now, I just want to briefly highlight what came out of the final report of the Aviation Rulemaking Committee that was just made public 2 days ago. And what the Aviation Rulemaking Committee very briefly said was that we need to create a pathway of reporting that's not punitive. In other words, we don't want to punish pilots who self-report or other observers who observe pilots with these symptoms. We don't want to make the situation punitive. In other words, we don't want to cause there to be penalties. And we need to, the FAA is working on revising the certification and qualifications for therapy of these conditions to ensure that there are screening protocols to identify individuals who need help with these signs and symptoms, and to expand our peer support programs, what we as pilots do for each other in terms of encouraging, divulging these symptoms, seeking help, seeking treatment, and improving our understanding of the prevalence of mental health and the fact that there are many treatment strategies available. And then improving, as we mentioned before, improving the education of aviation medical examiners for the identification and treatment of these syndromes, and improving the general awareness among the aviation community, including those of us in general aviation, about the need to do this. And we will, I'm sure, hear much more now that the Aviation Rulemaking Committee report has been published, but I expect that FAA is going to make this a priority in many ways to improve our understanding, and that's what we're hoping to do here this evening. So many of the points on this slide we've just made, and FAA is doing a lot to enhance their databases. As we mentioned, they're going to improve the training of aviation medical examiners, improving the way they collect and process information, and continuing a focus on this issue, mostly predominantly to improve aviation safety. This, once again, the report from the Rules Committee made it very clear that this is not going to turn into punitive action. We're not going to punish people for divulging the presence of mental health symptoms. We are going to encourage it, and then we're going to facilitate the management of mental health issues in the affected pilot population. So this is one day in clinic when my nurse and I arrived in the clinic both wearing purple. We thought that was a great day to record here with a photograph. This is Tammy. Tammy was a flight attendant, actually, and then left her flight attendant career and became a nurse. And she and I worked very closely in a cancer genetics clinic and saw a lot of women who were at risk for breast cancer and became really good clinical colleagues. And I'll use this as a lead-in to talking about the signs and symptoms of mental health. So just like many things in medicine, this is a spectrum, and it It starts at something very simple that we call mild cognitive impairment. Some days I think I must have mild cognitive impairment as I search for my iPad or ask myself, why did I come into this room and what am I looking for? Or where did I put my pen or my papers or my book? But this is not mental illness, but we all know, we've all seen colleagues and family members who ask the same questions or tell the same stories. We all have an Uncle Joe who every year at Christmas tells us the same story he's told us for the last 10 years, or missing appointments or losing things or losing your train of thought, having trouble following a conversation or TV or a movie, and difficulty making decisions or making bad decisions, feeling depressed, anxious, frustrated. This can be the beginning of more serious signs and symptoms, but it's a spectrum. And this is what Mayo Clinic calls mild cognitive impairment. Now, the next thing we want to talk about, if I can get the slides advanced, are signs and symptoms of not just mild cognitive impairment, but true mental illness. So we all feel sad or down at times, but if that's the prevalent emotion and it never gets any better and the individual is always sad or feeling down, that's important to recognize. Or confused thinking, or a reduced ability to concentrate. If we have a learner who can't focus, who can't seem to process what we're telling them in lessons, or have fears and worries that are out of proportion to the actual risks, or have extreme feelings of guilt or mood changes. We all have our up days and our down days, but things that are extreme, big swings in emotions, very high to very low, or withdrawing from activities with friends and family, and not participating in normal sort of social events, or being unusually tired, or having low energy, or reporting sleep problems, or having, Lord knows, delusions where they can't process reality effectively, or they have unreasonable fears, or they see things or hear things that just aren't there. Those are serious signs and symptoms. Or they can't cope with daily problems. We all deal with all sorts of problems. I'm sure that we will all recognize that flying is an exercise in dealing with problems and solving them. But if there's an inability or an excessive frustration in dealing with those problems, that's an important sign. If we can't understand or relate to situations and people, if we don't demonstrate any empathy, sadness at someone else's loss or someone else's difficulty, obviously drug or alcohol use, big changes in eating habits when somebody either stops eating or starts eating excessively, sex drive, we don't often ask about that, but if people mention that they've had a significant fall off in their libido or their sexual activity from what was normal, that can be a sign. Anger, hostility, violence, overt acts of anger or violence, or especially, and we'll talk a little bit more about suicidal thinking. Anyone who expresses an emotion that says, I think I'm going to kill myself. Now, we've all had those days where we say foolish things like, yeah, I think I ought to kill myself. But if the person has a method, if they say, I'm going to kill myself with a gun, or I'm going to take an overdose of pills, or I'm going to run this airplane into a mountain, or I'm going to drive my car over a cliff, those are serious signs of suicidal thinking and mental illness. The American Psychiatric Association, again, echoes some of those things we've just mentioned: sleep or appetite changes, these wild fluctuations in mood, being withdrawn, a drop in functioning, somebody who's usually present, active, involved, and they do things like they quit their recreational sports, or they stop coming for their flight lessons, or they can't do things that they've always done well before, or they simply can't think through problems. They can't respond to things like situational awareness kind of problems or scenario-based training. They can't respond to challenges of problem solving. They're overly sensitive to sights, sounds, smells, or touch. All of their senses are sort of accentuated, or they become very apathetic. They just don't care about anything. They don't want to participate. They just don't want to do anything. They have no interest in participating in any sorts of social or learning activities, or they feel just disconnected, not being part of the group or part of a school or an activity that was usually something they participated in. I think I went past it. And just to finish up on that, illogical thinking, people that say things that are wildly unrealistic, or excessive nervousness like fidgeting or fear or nervous feelings or unusual behaviors that we've not seen before, and all of a sudden somebody's exhibiting those behaviors, or changes in their performance. They're absent from lessons. Their ability to perform in typical lessons falls off. They have trouble interacting with other learner pilots or with their flight instructors or their coworkers. All of those things are signs of impending or present mental illness. So, given all of that, where does this leave us on this road to mental health? So let's talk about some of the practical things that we can all do when we see signs and symptoms. So if you're a CFI, or even if you're a pilot who's not a CFI, or you're a mechanic or an air traffic controller or an airport manager, if you see pilots that have suicidal thoughts or have signs and symptoms of this sort of mental illness, and it's very serious, you can certainly call 911. And if their behavior is truly bizarre, we can get the emergency system activated. We can encourage the pilot to call a mental health specialist. There are many communities that have these individuals. Difficult to get right in to see a psychiatrist, but many communities have psychologists, or they have doctoral level psychologists, or they have people like nurse practitioners or physician assistants who are trained in mental health counseling that can help us. There is a suicide hotline. One of the things that I learned as I prepared for this talk was that anywhere in the country, you can dial 988, just like we can dial 911 anywhere to activate the emergency system. We can dial 988, and that reaches a suicide and crisis hotline, which is available 24/7. And that's a number that if someone is seriously impaired, we should avail ourselves of. If the pilot or the learner or whoever it is shares information about who their primary care physician is, who their primary care provider is, and they give us permission, we could contact that provider and encourage them to help the individual that we're seeing, or encourage them just to reach out to a friend or a relative. Many of these problems have a spiritual foundation. So if they're part of a spiritual faith community, we can ask them to contact a minister, a spiritual leader, or someone else in the faith community to help. So there are many, many ways that we can point these individuals with symptoms to get help. So how would we summarize all this? Well, just like we're taught when we do our annual airport security training, remember that suicidal thinking doesn't get better on its own. Someone isn't just suicidal today and then tomorrow they're fine. The people that express suicidal thinking need help. And it's just like, when we talk about airport security, if you see something, say something or do something. If you see someone or know someone that expresses suicidal thinking, you need to act. So, and we'll tell you how you can do that. In addition to dialing that 988 number, we'll show you some other ways to act. Remember these signs and symptoms, things to look for: sleep or appetite changes, big mood swings from very high to very low, withdrawal from usual activities, a reduction in normal functioning, inability to do problem solving and to think, sensitivity to emotion or sights, sounds, smells, being apathetic, not being involved, being uninterested in normal activity, feeling disconnected from a group, saying things that are clearly illogical, nervous behavior like twitches or tapping or repetitive speaking, any unusual behavior, or a change in their school or work performance. These are all things that can be signs and symptoms of mental illness. Now, I am not a mental health professional. We pilots are not mental health professionals, but the point is we can get these individuals to those who can help them. How? Well, if you're a CFI or if you're not a CFI, we should all be alert to signs and symptoms of mental illness, as we've just been talking about. And we should regard mental illness like any other medical condition without stigma. We don't judge people who have high blood pressure or kidney problems or diabetes or arthritis or heart disease, and we shouldn't judge people with mental illness. We should offer a compassionate listening ear and make appropriate referrals. We are not psychologists, we are not mental health professionals, but if we see signs and symptoms that we've been talking about, we should encourage those individuals and help those individuals to get to places where they can receive the appropriate care that they need. We can be involved with primary care physicians if the patient, if the person who we're concerned about gives us the name of their primary care physician. We can certainly call that physician, get them in touch with mental health counselors, as we said, a spiritual advisor, psychologist, a clinical psychologist, a psychiatrist, someone that can help them. And again, with the pilot's permission, contact their aviation medical examiner and say, this is a person who we have concerns about, and maybe you want to revisit with them about their medical fitness to fly. It is also available nationwide. There is a National Alliance of Mental Illness, so-called NAMI, that has a helpline, and you can call this 800 number that's here on the slide, or you can text helpline to this 62640 number and get support and help, and we can direct individuals to these resources if they're having these signs and symptoms. And remember that early intervention can often minimize or prevent the emergence of symptoms, prevent hospitalization, and improve the outcome. So we should not be reluctant to point these individuals to these helpful resources. We should recognize that this is a prevalent problem. We can improve aviation safety by taking a part in this recognition and awareness and directing these individuals to the help in their communities. So I'll finish there, and I'm sure there might be some questions, or maybe I can clarify some things that weren't clear. Aaron, are there any questions that we need to address?
There's a lot of discussion tonight, and I'll tell you, this is a statement that's more like it's more of a statement than a question, but I think it encapsulates a lot of people's fears in our profession. And I want to phrase this in a way that's more about us at the grassroots level as pilots and instructors and mentors and mentees than let's talk about the FAA level. And I think you'll see what I mean here. So let's say that someone that I'm mentoring comes to me and says, I would like to go to a professional therapist to talk about relationship issues, but they are going to have to submit a diagnosis code in order for my insurance to cover it. And I'm worried about that because the FAA does not like mental diagnoses. So if I'm mentoring a person who says that, what kind of advice would I give them? Obviously, knowing we can't really give them advice beyond that here.
Right, but we can direct them to things like these helplines. Just simply talking to people might help. They can get into confidential counseling situations that don't necessarily have to end up in their medical record. Now, if it's serious, if they have serious depression or suicidal thoughts or something else, it should appropriately be in their record for their safety. But we should always emphasize that the important thing here is to get the management of the problems. And as I read the very preliminary findings from the Aviation Rulemaking Committee, they are going to go out of their way not to stigmatize among the aviation medical examiners these mental health diagnoses. And we should encourage people to get help and not to be fearful that they're going to lose privileges if they can get their mental health treated. And the issue is, again, getting back to safety. What we want to do is ensure safety. And if someone fails to get intervention for their mental health problems, they're impairing their own safety and maybe putting others' safety at risk. And so the encouragement ought to be, let's get these things taken care of, get you back to a state of wellness. And if you get back to wellness, then there shouldn't be any adverse impact on your ability to fly.
Perfect. Next question is a little bit more of a personal question from Jennifer. She says, I joined a little bit late, Dr. Vogel. I see that you're an oncologist and a flight instructor. What got you interested in mental health and aviation?
So here's a paradoxical answer. I think I started flying as a resident for my own mental health. When I got in an airplane as a resident, after dealing with all of the problems and the long work hours, flying was actually therapeutic for me. And it was, I've often said, and I was a breast cancer doctor. I said to my wife many times, there's no breast cancer in the airplane. There is none. And it was, to me, a wonderful, refreshing, revitalizing activity. And then I also would rather spend an hour flying than 4 hours driving. So it became a practical thing. And then in my academic career, I did a lot of invited speaking. And so I would often fly my airplane to my invited talks. And that too was in many ways therapeutic and rewarding. So that's how I got into it. And then at the tender age of 67, I said, well, I've been flying for 40 years, might as well become a flight instructor. So that's how that happened.
What drew you into thinking about pilot mental health?
Mostly the prevalence of it and the stigma that got attached to it. And, for many years in cancer therapy, cancer also had a stigma attached to it. And I can remember being with my grandmother and there being family members who had a cancer diagnosis, and it was all hush hush. And people didn't talk about cancer, and it was whispered behind closed doors. And so in many ways, what we're seeing now in mental health kind of reflects what used to be present in cancer medicine 30 or 40 years ago. And I think that it was my understanding that divulging cancer diagnoses and helping people deal with what at one time was a stigma associated with cancer is the same sort of situation that we find ourselves with mental illness now. And there's no reason that we shouldn't destigmatize this and bring it out in the open and improve our awareness, our understanding, and public education about mental health issues. And, it's all around us. Every time we see a mass shooting, we're witnessing mental health issues, and we need to, in addition to, those are criminal activities, I understand that, but in addition to the criminal impact of those activities, we also have to understand that people who are mass shooters or commit violent acts, they have a mental illness. And we as a society need to put more emphasis and understanding on mental health and mental health issues and get help for those people to reduce not only airplane-related suicide deaths, but also things like mass shootings and school violence and so forth. So that's really how I got interested in this.
Excellent. AB has a good remark/question. Thinking about the stigma, do you think that part of the stigma has come from this idea that a mental illness is permanent?
Yes. And yeah, I think, and we all have, literature and movie type experiences, movies like One Flew Over the Cuckoo's Nest. They're going to lock you up and put you in the booby hatch and throw away the key. We have that kind of view, but yes. And now with the excellent treatment that we have, be it talk therapy or medical therapy, most of these illnesses can be treated and corrected. And the AMEs tell me that there are drugs now for depression that are allowed for pilots to use. And I think we're going to see more movement in that direction to understand that these are treatable conditions like many other medical conditions. They're not permanent. They can be resolved, and people can get back to their flying activities. And I think that's the message that we want to get out.
Right. Jim asked a good question, and I think it's a really good one because a lot of your suggestions, of course, assume that the person who needs help wants help. So Jim says, what about someone who's either in denial or overtly hostile to getting help? How would we deal with that? We're trying to help them out, connect them with resources, and they either can't or won't listen to us.
Yeah, that's a challenge. So then we have to make appeals if we can get access to their care providers, their medical providers, to their family members, to their church community or their work colleagues, their peers, and get a group of individuals to say, we have a need to help you. Not that there's something wrong with you and you are ill, but we are here to help, and we want to find resources that can help you. And we know that these are problems that can be managed and treated and resolved. And I think that's for someone who's and that resistance may come because they fear this being judged or being ostracized or put off. And if we come to them as a group or as a community and say to them, we know this is a problem and there are resources that can help you, and we fully expect that just like any medical illness, you can get through these mental illnesses and return to normal functioning. So I think that's the way you approach a person who's resistant. And I've seen that in patients. I mean, I had patients with cancer who understandably were very depressed or they were anxious. And, I'd say, well, we have a clinical psychologist here in the clinic, and we really think you ought to see them. And oftentimes the patient would look at me and say, well, are you saying I'm crazy? No, you're not crazy at all. You're dealing with a very challenging situation. You've got a cancer diagnosis. We know that engenders all kinds of fears and anxieties, and we have people that can help you deal with those things and get you through that, and we can get those things resolved. And if we approached it in that kind of supportive, understanding way, very often we could get those resistant people to accept the help we were offering.
Excellent. So here's a new question. This may be in the weeds a little bit, but it's an interesting question. So I want to ask it. Maria asks, where do you see AI, artificial intelligence, fitting into therapy?
Well, that's interesting. The last time we presented this, when we presented at Mentor Live last month, we got a question about the military, and the military has operational risk assessments that they do before flights. And I can imagine, now I don't know this, I'm speculating, I don't know this for a fact, but I can imagine that there are probably psychologists right now developing artificial intelligence assessments to assess whether somebody has signs and symptoms of mental illness. So I would not be at all surprised if we see where you could go online, for example, and answer some questions and get a score. And the military does this already. They give a operational assessment and give you a score. And if you have mental health signs and symptoms, that score may suggest that you are temporarily not fit to fly. And so I think AI may become an asset or a tool here. And again, I'm speculating, I don't know, but I would not be surprised if that comes in the near future.
The beauty of live TV, went the lights, and now they're back. A little bit more of a somber note, but I think an important question for a lot of us as instructors. Chaz Ryan asks, beyond the signs and symptoms we've discussed, are there any other specific behaviors, mannerisms, tone of voice, et cetera, that we might be alert for as instructors? And he's specifically looking to try and identify who might be a suicide by flight risk. Obviously, that accident shook a lot of us up.
Yeah, well, anyone who exhibits overt abnormal behavior. So in other words, we're doing a flight lesson and they purposely put the aircraft into some dangerous, unusual attitude, or they make comments about flying in dangerous situations in low visibility or near thunderstorms or flying and icing. Any kind of comment that suggests that their risk-taking is beyond what anyone would consider reasonable. So if we see indications that either their behavior or their comments suggest that they're wanting to take unreasonable and unnecessary risks, that should be a red flag.
Right. Well, Victor, this was excellent. I think that it was even better that we were able to answer some different questions this month in February. And how cool was it that the ARC report came out this week and you got to look at that and give us some comments about it as well. So thank you again so much for doing this. This is, it's really, and nobody ever doubted it, right? But the amount of feedback that we've gotten for your presentation in specific, but just gratitude for covering this topic just really illustrates how needed it is. And so I'm looking forward myself to digesting the ARC report, and I encourage everyone else viewing to download a copy of it, and let's see what we're actually talking about here and focus on solutions rather than problems.
Yes, and I fully expect that that's what we're going to see, a heightened awareness and more educational programs for all of us, pilots, flight instructors, airport personnel, and more educational opportunities. So we can get this in front of everybody's mind, and we can get these individuals who need the help that they need.
Excellent. And also, if you are a NAFI member, Dr. Vogel has an article based on this presentation in the next issue, correct?
The May-June issue of Mentor Magazine will have an article about these very topics.
Excellent. All right. Well, thank you again so much.
My pleasure. Thanks for having me.